Have you ever wondered how military and disaster response teams prepare for emergency medical missions? In this video, we will look at the key factors that determine whether a deployable surgical table is truly ready for field use. These tables are essential for delivering medical care in challenging environments, where time, transport, staffing, and stability can all affect patient response. Deployable surgical tables are not judged by appearance alone. They are evaluated through practical readiness criteria, including load capacity, deployment speed, setup method, adjustment range, and evidence from real specifications. One important benchmark is a 135 kilogram load capacity. But capacity is only one part of the decision. Buyers also need to consider 4 mission variables: how the table is transported, how fast it can be deployed, how stable it remains during use, and how easily it can be cleaned and prepared for the next case. Before purchasing, teams should also review 5 evidence checks: written specifications, setup instructions, load test information, adjustment details, and supplier documentation. When evaluating a surgical table, it is essential to balance clinical needs with logistical demands. How fast can the table be set up? How many people are required? Can it be assembled without tools? What load can it support? How compact is it during transport? These practical questions help buyers understand the operational value of the equipment. A useful example is the PXTS2 from Pinxing. This model is designed with explicit deployment specifications. Can be set up in under 5 minutes by one person without tools. This kind of efficiency can reduce the burden on medical teams working in the field. Military and disaster response teams often prioritize quick, repeatable deployment over complicated features. In an emergency workflow, a surgical table may need to work alongside transport stretchers, lighting, storage cases, medical kits, and temporary treatment shelters. That means the table must fit into the whole system, not just function as a standalone product. Buyers should verify several essential specifications before purchasing. First, confirm deployment speed. Ask how the setup time was tested and whether one person can complete the process in realistic conditions. Second, review tool-free assembly. A simpler setup reduces the risk of missing tools, lost parts, or delays during urgent deployment. Third, verify load capacity. The stated capacity should be supported by evidence, not only marketing language. Fourth, check height and tilt range. The table should support different procedures while maintaining stable positioning. Fifth, evaluate transport volume. A table that folds compactly and travels with proper protection is easier to store, move, and deploy. A structured checklist helps buyers focus on mission requirements instead of flashy features. Important questions include whether one person can set up the table, whether the locking system is clear, whether the surface can be cleaned quickly, and whether the product can withstand repeated field use. In conclusion, the procurement of portable surgical tables should be viewed through the lens of mission readiness, repeatability, and logistical efficiency. The PXTS2 provides a useful benchmark because it connects concrete specifications with emergency medical use. For buyers, the goal is not simply to purchase a table. The goal is to choose equipment that supports effective medical response when conditions are difficult and time is limited. If you want to learn more about evaluating portable surgical tables or improving procurement readiness, visit our website or subscribe for more insights on industry best practices.